and Kachibu. I am Dina Ventura,
And I'm Francine Marquez,
and
and
welcome
welcome to
to
PairFect.
PairFect.
Hi,
Good
Dina. It's the time of the
afternoon.
week. Hi, how are you?
Okay, Wednesday.
Yes, it's almost May. How
Right.
quickly time flies, no?
Yes, and we are still in a pandemic.
Pandemic. But aside from that, well, of course, we're trying to keep safe from the coronavirus.
Yes.
But at the same time, there are all other diseases that we have to watch for also to keep safe from, especially now that
Mm-hmm.
the summer heat has come about.
Yes.
And we expect a lot of illnesses to avoid as well, right, Dina?
Mm-hmm. Which brings
Yes.
us to our guest
Guest
this
for today,
afternoon.
a
Yes.
very special man. For today's episode of Perfect, we have the former coordinator of malaria, other vector-borne and parasitic diseases at WPRO from 2015 to 2019, and has served the World Health Organization since 2011 in various capacities, including acting director for communicable diseases WPRO from May to October 2018 and May to July 2019. He's the regional entomologist, WPRO, and technical officer for malaria in Papua New Guinea. And now he's the World Health Organization representative to the Philippines. Let's all welcome Dr. Rabindra Abeyasinghe. I hope I got it right. Hello, Dr. Rabi. Welcome to
Welcome,
Perfect.
Dr. Rabi, to Perfect.
Good afternoon, and happy to be here. Thank you for the welcome.
Yes, so we'd like to find out, how are you coping with the situation right now on a personal level? I hope we trust that you're keeping safe as well.
Of course.
I'm doing my best, like everybody else. It's been a very, very challenging year and beyond since the onset of the pandemic.
Mhm.
It's no secret that the time has been very challenging for almost everybody on a personal level, on a family level, as a community, as a country, as a world. So I am no exception to this. It has been very challenging at times. We have had to take precautions. We have had to manage a new disease which we don't know much about, which we continue to learn about. And as medical personnel who are pretty much on the front line, we see the impacts and the effects of this pandemic. And it is very concerning to us. And so, at a personal level, this impacts on us because we see the medical issues, the underlying medical issues, and the challenges faced at an individual level, at a societal level, and as a community. So, the impact of the pandemic at a very personal level has been significant. It has impacted not only the way we interact with our near and dear ones, but also the public health measures that have been necessary to reduce the transmission of the disease has also placed restrictions on our ability to connect and to meet, even with near and dear family members. And all of that is a strain on me as it is a strain on everybody else. So I am no exception. I share those challenges with many other people in the community. Thank you.
Dr. Rabi, so you're based in the Philippines right now?
Yes, that's correct, Manila.
Yes. And what has been your day like since the start of the pandemic?
24 hours, but most of it has been work.
Mhm.
Because we are supporting the government response, and because health is an essential service,
Mhm.
it has meant that we have worked throughout the various quarantine levels So I haven't had the privilege of staying at home or working at home.
Mm.
To work on a daily basis. My work days have been longer than usual. So I work about 12 or more hours on a daily basis, and that sometimes goes into the weekends also.
Wow. So, could you tell us a little bit about your experience as the representative of the World Health Organization in the Philippines? Like, what sort of work do you do, and then how has this changed when the pandemic struck?
I mean, let's start by saying I have been blessed to be entrusted with this responsibility. I have been blessed to be able to help and support the Philippines in the response. The experience has been challenging, of course, because it's not an easy situation to be in. The Philippines has and continues to deal with the COVID-19 pandemic, which we call a public health emergency of international concern. But importantly, many people have forgotten that we are also supporting the government to deal with a second public health emergency of international concern, and that is the ongoing polio outbreak, which we are trying to close, which has been going on since 2019. And so the experiences that I have been
Sa ngayon, iginiit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginiit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginiit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginiit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginiit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon,
that help me do my duties and help me to function as the WHO representative here in the Philippines. And when I say my team, as from a WHO perspective, I particularly mean my team in the country office in the Philippines, but also as WHO. We are supported by an extensive network of experts, both in the Western Pacific Regional Office, my former office, but also from the WHO headquarters. So it has been good to have those connections and to be able to support the Philippines in my capacity as WHO representative. Thank you.
Dr. Rabi, recently there was a WHO Philippines statement saying that they're worried over the red line capacity of our healthcare services. How do you think is what is the World Health Organization in the country doing in line with that? So you think, I mean, there's the promise of the vaccination is there already, but numbers in terms of infection are still
Rising.
spiking, and your organization has expressed their concern over that.
Yeah, that's correct. My regional director, Dr. Takeshi Kasai, mentioned
Yes.
are concerned about the impending approaching of a red line situation. A red line situation, which meant that we were concerned with the increasing number of cases and the possibility of the healthcare system being overwhelmed. We have been nearing that situation in the NCR plus bubble, where I don't need to not tell you this, but all of you know how difficult it has been for people who have wanted to access healthcare in hospitals.
Dinagsa ng mga gustong humingi ng tulong ang community pantry sa Maginhawa Street sa Quezon City. Umaga pa lang ay mahaba na ang pila sa lugar. Una nang may nagpaabot ng concern dahil maaari umano maging super spreader ang pagpila ng mga tao. Ayon sa ina ni Ana Patricia noon na siyang nagpasimula ng community pantry sa lugar na si Jenna Bernardo, ay naiintindihan niya ang pag-aalalang ito.
The healthcare workers find it difficult to manage the number of patients they need to manage. of course, they cannot provide the kind of attention that patients need. And we know that some severe COVID patients need very close attention in intensive care units. And when you can't provide that kind of environment for health workers to deliver the support they need, they become stressed out. We see treatment care levels falling, and that contributes to increases in patient deaths. And this then goes into a vicious cycle with healthcare workers also getting infected. So this was what my regional director mentioned when he said he's concerned about the approaching red line situation. Possibly we can see such examples in some of the countries that have been significantly affected by this pandemic, which continues to evolve and surprises the way it's evolving. So when we look at last July, August, the Philippines seemed to be able to cope and manage. But then we saw at the end of March then such a rapid increase in the number of cases and a very quick filling up of the healthcare facilities. And we continue to be concerned, and we do appreciate the efforts by the National Task Force and the Department of Health and the government to expand access to healthcare facilities. But it's not just an problem of access to facilities, it also needs to be accompanied by increasing the deployment of healthcare workers.
Right.
Those healthcare workers trained. So that level of concern still remains because we are not really out of the woods as it is as yet. So we continue to engage and support the government's effort. We acknowledge that you have here a whole of government effort. I want to make special mention of the private sector who have also risen up to contributing to that challenge. And that's refreshing to see, but there still is room for us to be concerned. And hopefully we will be able to prevent a complete overwhelming of the health system and to ensure that the best possible care is provided to all Filipinos. Thank you.
Dr. Rabi, do you think there's a possibility for like international volunteers and experts to come in since we lack healthcare workers?
Well, Philippines has traditionally been the exporter of healthcare workers to the world.
Yes.
The irony.
But this pandemic has shown that if there is a need, we may have to do that. And yes, we have looked at those options. If the need is there, we will be ready to mobilize people. But given the challenges faced by many other countries today, we do recognize that that may be an option we'll have to look to. But I want to acknowledge that you have managed to cope so far, and we can maintain the current positions and continue to follow the guidelines. We may be able to circumvent such a deterioration of the situation. So we continue to work and urge everybody at a very personal, at a family and community level to do everything possible to prevent a complete overwhelming of the systems.
Yeah.
Do you think, Dr. Rabi, that the rollout of vaccinations has become a factor also why people have become more laid back and thus the spike in infections?
This is partly true. We have seen that, and we have been very clear that vaccine supplies are limited. We need to maximize the use of vaccines so that we protect more lives by vaccinating first the healthcare workers and then the elderly and the comorbid who are facing a significantly higher risk of complications and death before we make vaccines available for everybody. But the mere fact that the vaccines are available has led to some degree of complacency in following the
Protocols.
difficult restrictions on physical distancing and not mixing as a community. We recognize that culturally are a very closely knit community, but the pandemic has placed restrictions, and this has caused a lot of stress and fatigue to people over the long period. And with the advent of vaccines, even though the groups that would not be eligible to access vaccines early have particularly been complacent in following the requirements. And this is one factor that we have clearly identified as a contributing factor to the current surge we are seeing, not only in the Philippines, but in other countries
Other
also.
countries. Yeah.
But also we are conscious of the fact that we are also seeing a continuing process of the virus mutating into new variants, and these new variants becoming increasingly more transmissible and possibly replacing the wild type viruses, resulting in the kind of high transmission rates we are seeing in some parts of the country. So our assessment is that these multiple factors have contributed to it, and it has been challenging to respond to this evolving situation in NCR and the adjoining regions, but we
Dinagsa ng mga
believe
gustong
that
humingi ng
these
tulong ang
variants,
community pantry sa
will
Maginhawa
also
Street sa
spread
Quezon
into
City.
other
Umaga pa
areas
lang ay
where the
mahaba na ang
healthcare
pila sa
systems
lugar.
are weaker,
Una nang may nagpaabot ng
capacity
concern
is more limited, and so we have like a window of opportunity now to prepare throughout the country in all the regions for this situation that may evolve in the next few weeks. Thank you.
Dr. Rabi, speaking of stress and challenges, I was just wondering, you hold a very important position as a World Health Organization representative to the Philippines, and so far the cases here have not really eased up. Do you feel any pressure at all in handling the job at hand?
Well, as I mentioned, it's not been easy, and it's not been easy for many reasons. One is we are dealing with a new virus, something that we don't know, which continues to evolve and change. And so it continues to be a challenge for us to understand how to respond to these evolving changes of the virus. But beyond that, it's also been a challenge because this pandemic has necessitated that we have a whole of government response. And we do understand that it is primarily a health issue, but this pandemic has significant impacts, not just in health, but in also practically every other sphere, particularly in the economic sphere. And this has massive impact on people's ability to access their livelihoods, to practice their professions. And so it has been very challenging that response to this health crisis and managing the economic outfall of that so that we minimize the economic impact, but also ensure that the pandemic is responded to as optimally as possible.
Okay, I can really just imagine how hard it must be to face each day and make decisions in line with how to address this pandemic with everybody else in the country. But Dr. Rabi, is there anything that makes you happy or proud about being where you are right now, holding a key position in the World Health Organization? But before you answer that, let's pause for a short break. We'll be right back.
Montero Sport. Elevate your journey.
Drive your ambition. Mitsubishi Motors.
Araneta City, home to the country's first indoor shopping mall, the world's original Thrilla, and the first ever Bini Bini pageant. Now a place for your first win, your first catch, your first home, your first big break, your first date, and even your first love. Araneta City, the city of firsts.
And we are back on PairFect. I am Dina Ventura, and I am here with Francine Marquez. And our special guest for this afternoon is the World Health Organization representative to the Philippines, Dr. Rabindra Abeyasinghe. I hope I pronounced that right. Before we took a break, we were asking Dr. Rabi about his job. I mean, how do you feel about it right now? I mean, what makes you happy or proud about being there at this moment in history when things are transforming and changing for everybody in the world?
I know this, thank you. This is a unique moment in history, and I'm hoping that many of us will be at some stage able to look back at this period in history and be happy with what we have done or what we have contributed to achieving. And I must say I'm incredibly proud to be part of WHO at this point of time for many reasons. We are not only supporting the global response at a global level, but also we are supporting more than 180 countries in how they respond to this pandemic. And from my perspective, I have been, as I mentioned, fortunate to be entrusted with this role. I have been blessed to have a very dedicated team of global health experts from many countries of the world working with me here in this office, but also being supported by an excellent team of professionals from the Philippines. So our country office team has a mix of experts from many, many countries of the world, but also a team of Filipino professionals who are working together with us to help the response in the country. And so to be part of WHO at a very crucial moment in history like this, I think it is a privilege. We understand the responsibilities that we have. I'm proud that all of my team members understand the seriousness and the dedication that is required to respond to this. Our every effort is aimed at seeing how we can preserve as many lives as possible as we help the government to respond to the situation in the country. Yeah, so I am actually proud, and I'm also happy that I can and I am able to partner with a very dedicated team at the Department of Health and by Secretary of Health, Dr. Francisco Tito III, an incredible team of professionals there, also working probably long hours than me and working 7 days a week, trying to help the government's whole of government response to this pandemic. So yes, I am proud that I can partner with such a dedicated team. I'm proud that I can work with the National Task Force. And so it has been a good engagement that we have had. We continue to try to improve the response. As I said, it's not easy. We need to try to calibrate and maximize the health benefits while also recognizing and trying to minimize the adverse economic impacts on people and communities. So it's not been an easy 15, 16 months, but we continue to strive to do what we can. Thank you.
Okay.
Dr. Rabi, at various points in your career, you were handling research study and making solutions about communicable diseases. Do you think it has somewhat prepared you for this kind of global pandemic that we're experiencing right now?
Well, I never prepared myself for a global pandemic. I prepared myself as a public health expert, and this was part of our training. But I will be honest, I never dreamt that I will have to respond to a pandemic during my lifetime. The last pandemic was in 1918, and that was not a factor that I saw at any stage when I was preparing for this career. But as I said, has been a steep learning curve. I have been happy that we have had very good guidance, both at the regional level, led by a very competent regional director in Dr. Takeshi Kasai, who himself is an expert on outbreaks and emergencies. And so I have been fortunate that I have been able to experience the mentoring, both from the regional office and the headquarters, and of course build on my training and skills that I brought through long years of work. Thank you.
Dr. Rabi, was there ever a time that you were practicing medicine in your country? How long was that? Do you miss it?
I haven't been practicing clinical medicine now for more than 10 years.
Wow.
Previously, I used to practice, but since I've been with the organization, I haven't been practicing clinical medicine. I've been more public health expert.
Okay. Wow. So, how was your journey? How did you end up in the World Health Organization?
Well, that's a very long journey. You might need a much longer program for that. But I'll give you an abridged version. So yes, I graduated and then I specialized in public health and tropical diseases. So I did my doctorate in Sri Lanka, where I come from. I am Sri Lanka. But then I proceeded for further studies to the United Kingdom, and I have a master's degree and a diploma in tropical medicine and hygiene from the Royal College of Physicians. So I have the training that was expected. And so after that, I worked for nearly 20 years at various levels within the Ministry of Health of Sri Lanka before I opted to join WHO. So all of my years of long experience and now more than a decade of work within WHO have, I think, prepared me to do what I'm doing now.
Yes, that's led you to this major task, right, Francine? I can't imagine what it must be like to be facing such a responsibility for our
Dr. Rabi,
leaders.
aside from, well, COVID-19, which is the biggest and deadly disease right now, what other tropical diseases should we watch out for, especially during this season that probably WHO is also focusing on?
So what we need to be in the Philippines, we continue to be concerned with the high levels of transmission of tuberculosis, HIV. We do recognize that you have a big problem of dengue, which is to pop up at times, especially when you come into the wet season. So, and it does not mean that COVID-19 has meant displacement of these problems. These problems are there. And we have been doing our best to support the government in maintaining those routine health services that will help to contain the spread of those diseases. But we have to recognize that clearly we need to now, in this time of surge, focus our efforts on COVID-19 and bring this situation under control. And then hopefully bring back the other services also as quickly as possible. Thank you.
I see. Well, one of the qualities that I noticed about the leaders who were taking very active roles in the COVID-19 response has been calmness and, just seriousness. In your opinion, Dr. Ravi, does the leader's seriousness affect the way the team responds to the situation?
I'm not quite sure what you mean by seriousness. Could you clarify?
Like how have you chosen to handle this as a leader of a team?
Yeah. So thank you. No, that's an interesting question because we have a dual role to play in this as a minimum, and that is supporting the governments and the national response. But also at the same time, we take it very seriously that we look after the welfare of our staff and dependents. And because you are as good as your staff.
Yes.
And your team is. So we do recognize that our duty of care is a major factor. So while supporting the national response to COVID, we continue to almost on a daily basis to do whatever possible for the protection of our staff and their dependents. Because if we don't do that, they will not be in a physical or mental condition to deliver on their functions. And so we recognize this and we try to facilitate and provide for them and ensure that they can all continue to focus on what they need to do in supporting the national response. Thank you.
Okay.
So, surely, Dr. Rabi, you've been exposed to, of course, a lot of media interviews and questions. How do you respond to criticism, if ever there are given? How do you respond to maybe negative feedback shared to you by media?
Oh, that's if it is when, because it happens, and what COVID-19 has demonstrated with the infodemic is that we have had criticism from many angles, and that's not just me as an individual, but also us as an organization. And we do recognize that it has been a challenging time for many people, and we do recognize why there is some criticism. Criticism, if it is done with positive intention, it's valuable because we take note of those and we try to see how we can improve and be better people and better professionals. But sometimes, unfortunately, criticism is also very personal and very, let me say, unjustified. And in those cases,
Sa ngayon, iginit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon. Sa ngayon, iginit niyang nananatili pa ring maayos ang paghawak ng gobyerno sa sitwasyon.
That is part of the culture that we have today in the world. And so we have to deal with that. That is the reality. If you are doing something or not doing something, there is the freedom for people to criticize you. So there is value in constructive criticism and that's easier to accept. But when criticisms are unfounded and unjustified, it's harder to accept, but that's something we've got to live with.
Yeah, I think one of the major ones that people were complaining about was the speed of response at the beginning of the pandemic. I think that was it. That made a lot of people, because there are many ways to address the situation. You can either panic or do it calmly, and I think we know which way our government has chosen to go. So anyway, that leads us to another aspect of this situation, which is the vaccine supply. What can you say about this, Dr. Rabi?
So we have made significant strides. Never in the history of the world have we been able to develop a vaccine within 1 year of identifying a pathogen or a microbe which causes a disease. So this has been very uplifting and very encouraging. But early on, already in last April, we recognized that vaccine access is going to be a challenge. And as our Director General rightly pointed out, the inequity in vaccine distribution is actually a global moral failure. The fact that we as a global community have failed to make vaccines available to those who really need them most.
Yes.
The healthcare workers who we depend on, who sacrificed and have been ready to sacrifice their life on a daily basis, going into work to manage COVID-19 patients. That is a catastrophic moral failure that we as a global community have not been able to protect those people across the world, wherever they are working.
Yes.
Then we've also failed to protect the most vulnerable, the most at risk, the elderly, the immunocompromised, those ones who have significant comorbidities, who we know that if they are affected by the disease, will have many-fold higher mortality rates than the normal population. So when we prioritize to vaccinate people for economic reasons or other reasons and do not consider life as sacred and do not vaccinate those people, that is indeed a catastrophic moral failure. So we continue to urge everybody to follow the prioritization, to provide vaccines to those most vulnerable groups so that we save more lives. And this has been challenging and it remains challenging because of the very well-known issues that we are seeing globally, right? We know that nearly 88% of the vaccines have been distributed among rich and upper income countries.
Yes, I feel very strongly about that. The catastrophic moral failure that we are seeing in the world. Yes, but I really commend the World Health Organization's efforts in trying to help government make the access to treatments or preventive measures available to all Filipinos. I think that's a good thing.
We will continue to strive to do that. So the ACT Accelerator, where the COVAX facility is the pillar for vaccines, we committed last year that we will provide vaccines to protect the 20% of the most vulnerable Filipino population during this year. And we still believe that we are on track, even with the emerging challenges to access vaccines globally, that we still can maintain that. We still believe we will be able to keep to our commitment and provide those vaccines to the Philippines. So we continue to work with our partners at CEPI, at Gavi, at UNICEF, who have been tremendously cooperative, who have been doing everything within their abilities, who have been supported by an excellent network of donors and donor countries. But we still need to do a lot to increase manufacturing capacity so that countries can access vaccines with the speed that they do require.
Dina, I think, well, we still have a lot more of questions. We still have a lot of questions for Dr. Rabi, but we'll pause for a break meanwhile. Then we'll be right back. Hello, good afternoon, and we're back. I'm Francine Marquez, and I'm with my co-host, Dina Ventura, and we have a very interesting and very insightful conversation this afternoon with our WHO representative to the Philippines, Dr. Rabindra Abeyasinghe, or Dr. Rabi for us. Dr. Rabi, WHO launched the Access to COVID-19 Tools ACT Accelerator last month. Can you explain this to us? What is this all about?
So the ACT Accelerator was actually launched 1 year ago. We celebrated 1 year last month, early this month. The purpose of the ACT Accelerator was to increase access to COVID-19 tools. And the ACT Accelerator is probably the partnership that has been able to deliver the most coordinated and successful delivery of tools addressing the COVID-19 pandemic. So under the ACT Accelerator, we have 3 pillars. One is the diagnostics pillar, the second one is the therapeutics pillar, and the third one is the COVAX facility, the vaccines pillar. But we also have a health systems enabling pillar, a cross-cutting. And so it's this whole effort that was set up in April last year. And we set this up because we recognize that in previous disease outbreaks, it has been challenging to provide the necessary solutions to the poorest and weakest countries of the world. So WHO led this effort to establish the ACT Accelerator, and we have used that to fast track the development of diagnostics, to development of identification of therapeutics and mass producing those diagnostics and therapeutics, but also the development of vaccines and mass producing those vaccines. So in many of these situations, the support that was necessary to fast track the development of those products has come through the ACT Accelerator initiative. And we are now working to enhance global equity through the distribution of those very necessary and essential tools to every corner of the world, to every community as quickly as possible.
Okay.
But we need to recognize that we still have a significant funding gap to achieve the targets that we want to achieve through the accelerator. And besides the funding gap, we also just talked about the very particular challenges we face in scaling up production of some of these products so that we can make them available in an equitable manner across the world.
Are you happy with the way it has rolled out? After a year, the ACT Accelerator?
Yeah, so we are very encouraged by the way the ACT Accelerator has been performing, and particularly, I think the most attention has been towards the vaccine component of the COVAX facility, which has been able to, since the beginning of this year, deliver vaccines to nearly 100 poor and low middle income countries. We are below our projected targets, but we have delivered vaccines to many of the 190 countries that signed on to this effort. And as we continue to work towards improving the efficiency and effectiveness of these interventions and addressing the bottleneck challenges, and urging the global community to address those challenges, we continue to rely on this platform to provide speedy and rapid equitable access to all the COVID-19 tools across the world.
I think, yes, we can all agree that everybody in the world would want to speed things up, and so we can get back to what we call the normal life that we used to know. And I think that's also been one of the reasons why people are also bringing forth other solutions like the ivermectin. What can you say about that, Dr. Rabi?
I'm not quite sure that that's a solution. That's a sign of desperation. And that's understood because people are trying to identify what will help to protect them and what will help to prevent them from infection or severe disease. Now, unfortunately, we have been through this many times during this pandemic when social media have been used to promote unsubstantiated, unproven products with little or no efficacy, which subsequently we have been able to demonstrate through the solidarity trials where we tested these out. So what we have been clear is with ivermectin also, we don't have the evidence that it is effective. So we are urging everybody, and we do recognize that people are desperate to get something, but if this is not the solution, we shouldn't create hope. And for us to be sure that this is the solution, we need to leave room for the clinical researchers and the doctors to evaluate this and come to independent conclusions before we create unexpectable expectations, unrealistic expectations in the minds of public, because that could be very harmful. I have personally information of people who put their trust in ivermectin and subsequently became infected, or who put their trust in ivermectin and developed severe disease. So I know many such situations, and so this is why we continue to urge, similar to hydroxychloroquine a few months ago, that unless we have independent verification of the efficacy and usefulness, we should not create hope in people who are desperately looking for a solution. That is unethical.
I see. Well, I think, Francine, that'll be another story entirely on the arguments versus ivermectin.
Dr. Rabi, I'd like to find out, How do you feel about the current community quarantine status that's being brought up by government, like what they call the hybrid MECQ? Based on the weekly reports that WHO has been coming up with, do you think this is feasible?
So let us be clear. We have, as a primary response, been advocating for so-called public health behaviors that will reduce the transmission. And we have been advocating for an expansion and development of healthcare systems, capacities, diagnostics, etc. But many countries have seen that due to various reasons, these measures alone are not enough. And this is why WHO has been advocating for strengthening of contact tracing systems and identification of amplifying events and scenarios so that early measures can be taken to target those situations and locations and circumvent the need for large-scale lockdowns with very damaging economic consequences. But unfortunately, in many situations, inevitably because of changes in the virus, because of events that have happened, it has been necessary for countries to go into larger scale lockdowns. Now, this is not the preferred response. This is the last measure that we advocate when it becomes clear that if we don't do this, the healthcare systems are going to be overwhelmed and you're going to have a very large number of deaths. So, and this is why we are advocating to use the data, to use the epidemiological information and to go for very targeted restrictions of movement so that we minimize the economic impact. But when those measures don't work for whatever reasons, then we have to fall back on larger scale lockdowns.
Okay.
Even though we know that it causes very significant economic and other impacts to society. So this is something that we do recognize. And in this instance, we've seen that the government enforced what we call the most stringent measure or the enhanced community quarantine in the Philippines at the end of March when we saw the surge happening. And we believe that those measures have led to some degree of controlling of the transmission. So we're now seeing on a daily basis something between 8,000 and 9,000 positives being reported. This is different from a high of 12,000. 11,000, 12,000 reported a few weeks ago. But as I mentioned before, we still remain concerned about the need for healthcare, the problems in accessing healthcare. And so it will be necessary for maintaining this kind of situation that we currently have for a few more weeks. Also, we hear increasingly of possibly going for a MECQ extension for another 2 weeks. This is up to the government to decide, but with some degree of flexibility for key economic sectors. And as long as those key economic sectors are clearly identified and don't contribute to large-scale transmission, and we can control transmission on those settings, this may be the way to go, because we have to recognize that we have to minimize the economic harm caused by the stringent lockdowns. Thank you.
Dina? At this point, I think we have some photos to show Dr. Rabi. And Dr. Rabi, maybe you can tell us a bit of something about these photographs
I will try.
on social media. First photo.
That is, that's the arrival of the COVAX vaccines, the first shipment of AstraZeneca vaccines from the COVAX facility to the Philippines.
Mm-hmm. And this one.
And this was, I believe, us handing over some supplies to the Department of Health in response to the COVID-19 pandemic. I believe it was personal protective equipment early on when we were having challenges in accessing personal protective equipment.
Yes.
I can't recognize the people there.
Not sure. So many flags.
There's so many
Yes.
facts that I find it. I think that is Ambassador Luke Perron when we launched the European Union funded grant for COVID response that is supporting 8 countries across the Southeast Asia region, including here in the Philippines. So, yeah.
Okay, so thank you very much. That was just a few pictures that shows us a
Yes.
little bit of the kind of work that Dr. Rabi does.
I guess it's just a minor percentage of the magnitude of work and challenges that Dr. Rabi is facing right now,
Yes.
together with his team from WHO Philippines. Yeah.
I really wish we had more time to talk this afternoon and so
Yes,
many more
yes,
questions. But I'm really happy that we had you with us this afternoon, Dr. Rabi. We wish you the best of luck and good health always.
And perhaps we can't just say goodbye to each other without asking Dr. Rabi for some parting
Yes.
words.
Okay.
Thank you, Dina, and thank you, Francine. It's been a pleasure talking to you. I have one request. I always ask media to help us share and spread the correct advice regarding COVID-19 because it's critically important for the media to be credible partners with the government and with WHO in sharing credible information and helping the people respond appropriately. So I really do appreciate what the media does, and I look towards all media outlets to continue to support us in that effort. Thank you.
Okay. Thank you very much once again. I am Dina Ventura.
And I'm Francine Marquez.
And this
And
is
this has been
PairFect.
PairFect.